Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the muscles of the arm. The arm has two compartments, anterior compartment and the posterior compartment. In the anterior compartment, we have the muscles Coracobrachialis, Biceps Brachii, and Brachialis. In the posterior compartment, most important muscle is the Triceps Brachii, and we'll also add the Anconeus. Let's go through the muscles of the anterior compartment of the arm. The coracobrachialis muscle, it takes origin from the apex of the coracoid process. Insertion is linear roughening on mid-shaft of the humerus on the medial side. Nerve supply by musculocutaneous nerve, root value C5, C6, C7, and this musculocutaneous nerve is a nerve from the brachial plexus from the lateral cord. Function of coracobrachialis is flexion of the arm at the glenohumeral joint or shoulder joint. Biceps brachii, it has two heads. Its name is biceps, long head, that takes origin from the supraglenoid tubercle of the scapula. Short head takes origin from the apex of the coracoid process along with the coracobrachialis. Okay, so nerve supply of the biceps brachii is again musculocutaneous nerve, root value C5, C6. Insertion of biceps brachii is radial tuberosity. Action or function of the biceps brachii is this is a flexor, powerful flexor of the forearm at the elbow joint and supinator of the forearm, accessory flexion of the arm at the glenohumeral joint. Okay. Then we'll go to the brachialis muscle that takes origin from the anterior aspect of the humerus, medial and lateral surfaces, and adjacent intermuscular septa. Insertion to the tuberosity of the ulna. Innervation by the musculocutaneous nerve. Root value of the musculocutaneous nerve is C5, C6, and this nerve is coming from the lateral cord of brachial plexus. We'll also get some contribution, little bit contribution from the radial nerve by C7 on the lateral aspect of the muscle. So this brachialis has dual innervation, mostly by musculocutaneous nerve, partly by the radial nerve. Action or function of the brachialis, powerful flexor of the forearm at the elbow joint. We have a clinical note on biceps brachii muscle that is innervated by musculocutaneous nerve. A tape on the tendon of the biceps brachii at the elbow is used to test predominantly spinal cord segments C6. We call it biceps jerk or biceps tendon reflex. A hammer is used, the reflex hammer is used to hit on the thumb, which is on the tendon of the biceps brachii, and when there is stroke on the nail bed of the examiner over his thumb over the tendon of the biceps brachii, there will be movement of the elbow joint. Okay, so that is the biceps tendon jerk. We test the C5, C6, mostly C6. Muscles of the anterior compartment, we got that. It is somewhat uncommon for muscles and their tendon to rupture. This is a clinical note. Nonetheless, the tendon of the long head of the biceps brachii muscle ruptures the most frequently. Long head goes through the intertubercular groove. Okay, so it has more chance to be ruptured. It goes to the intertubercular groove here or bicipital groove. Okay, This has comparatively little effect on the upper limb when taken alone, but it does result in distinctive deformity known as the Poppy sign. This tendon is jerked, then this will go here, we'll get a Poppy sign here, a swelling, which is a very noticeable bulge of the muscle belly when the elbow is flexed due to contraction of its uncontrolled fibers. Ruptures of distal biceps tendon also happen. It may happen here, but this is rare. Okay. So muscles of the posterior compartment, we go to the muscles of the posterior compartment of the arm. Okay, we've done the anterior compartment. We got the Poppy sign and the biceps tendon jar. Now we go to the posterior compartment. We have one main muscle, that is the triceps brachii muscle. Some book also add the Anconeus. This is the triceps brachii muscle. This is the muscle, the long head, the medial head, the lateral. This is the lateral head. So these three head together forms the tendon that's insert on the superior part of the olecranon process. Okay. If we go there, here is the biceps brachii long head. This is the short head, and this is they combined to form that. This part has been taken out, biceps brachii. This is the continuation of biceps brachii, and this insert to the radial tuberosity. Okay, this is the brachialis muscle inserts to the coronoid process and tuberosity of the ulna. This is the Coracobrachialis inserts to the middle of the shaft of the humerus on the medial aspect. Okay, we got the triceps brachii muscle. Its nerve supply is radial nerve. This is the triangular interval. This is the passage for the radial nerve and the profunda brachii artery. This is the quadrangular space. Okay, so this is the quadrangular space for the passage of the axillary nerve and posterior circumflex humeral artery. Okay, this is the quadrangular space for the axillary nerve and posterior circumflex humeral artery. This is the upper triangular space. We call it triangular interval. This is called triangular space. That contain the circumflex scapular artery. Okay, we got the triceps muscle here. Origin long head from the infraglenoid tubercle of the scapula, medial head posterior surface of the humerus, lateral head posterior surface of the humerus. Insertion to the olecranon process of the ulna, innervation radial nerve C6, C7, C8. Action, extension of the forearm at the elbow joint. Long head can also extend and adduct the arm at the shoulder joint. Another muscle, some book add here, some book add to the forearm extensor muscle. Anconeus. There is a small muscle. It takes origin from the lateral epicondyle of the humerus. Insertion to the olecranon process. We included this Anconeus as a part of the posterior compartment muscle of the arm. Okay, nerve supply, Anconeus, radial nerve C7, C8, T1. And function or action, weak extension of the elbow joint. Triceps reflex, the tendon reflex, the reflex that elicits involuntary contraction of the triceps brachii muscle. It is sensed and transmitted by the radial nerve. Test can be performed by tapping the triceps tendon with the sharp end of the reflex hammer while the forearm is hanging loose at right angle to the arm. A sudden contraction of the triceps muscle causes extension and indicates a normal reflex. Okay, so these are the bony attachment. Let us summarize again. We have the biceps brachii, short head coming from the tip of the coracoid process along with the coracobrachialis. The long head should come from the supraglenoid tubercle of the scapula. Okay, they will unite, and they will be the biceps brachii will insert to the radial tuberosity. Okay, we got coracobrachialis coming from the tip of the coracoid process, inserts to the shaft of the medial aspect of the humerus. We have the brachialis muscle taking origin from the lower part of the anterior anterolateral intermedial aspect of the humerus. This inserts to the ulnar tuberosity and coronoid process. Okay, we got the muscle. Triceps muscle, long head coming from the infraglenoid tubercle. Then the lateral head from the upper part of the posterior aspect of the humerus. Medial head from the lower two-thirds of the posterior surface of the humerus inserts to the head of the polycoronal process. And the Anconeus takes origin from the lateral epicondyle of the humerus, inserts to the lateral aspect of the polycoronal process of the ulna. And that's all about the muscles of the arm. If you have any question, please feel free to ask me. Please share the information with me, with your friends, and please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.